Well, I'm standing here together today with Jamie. It's December 8th, 2015. Jamie, what kind of surgery did you have and where are you from?
I'm from New Zealand and I came for a disc replacement in L5S1.
What kind of symptoms did you have prior to your surgery?
I had a lot of nerve pain in my feet and numbness in my feet, a lot of sharp pain in my lower spine.
And what kind of treatment was offered to you in New Zealand?
In New Zealand, the only options really were to have a fusion surgery or to take drugs and put up with the pain. So.
Right, and how did you find out about the ONZ and the possibilities of treatment in Germany?
A friend of mine mentioned somebody having a disc replacement a long time ago, and so I started looking up disc replacements online, and it came up with a company called SkyGen in Australia, which has reasonably recently, I think, picked up the agency for ONZ, and I reached out to them, and then it's history now. So,
Right, and who did your surgery?
Dr. Best did.
Right, and now, as of today, how many days ago was your surgery, and how do you feel today?
I don't even know what day it is, but I think it was probably about a week ago now, and I'm feeling much better. I have some small surgery pain, but the nerve pain in my spine is gone. So.
Right, and now you're currently at Medicos for post-surgical rehabilitation. How do you experience the setup here and the setup, the treatment concept, the connection between surgical intervention and post-surgical rehabilitation?
I think it's really impressive. I haven't seen anything like this in Australia or New Zealand, and it's something I think they could learn from in New Zealand because my father recently had a fusion surgery 6 months ago, and they discharged him from hospital, and he went home and I think had one physio appointment since then. So I do worry that it will lead to further costs to the government down the track for further fixing, and because people aren't using the right activities going forward. So.
All right, and now as a final question, how confident are you that you have done the right decision, that this is your, the beginning of a better future for yourself in terms of, private socialization, sportive activities?
I'm really confident. You're always nervous when you have different pains that you didn't have before you came in, but they're all pains that everyone is saying we can get rid of. And so the fact that the pain has gone on my back, it's been 16 years for me of pain. So I'm enthusiastic about getting back to sport and getting back to running and riding. So.
All right. Would you recommend it to anyone else who is in front of the decision of either having a fusion surgery versus a motion preserving intervention?
Of course, I'm actually writing I don't even know what to call it, but a description or a story to help SkyGen, I think, in Australia, to help younger patients make the decisions, because it's a really big decision. It's a lot of money, and it was hard for me emotionally to make that decision.
Mm-hmm.
And so I'm putting together notes and some things I'm going to send to them to help them make people feel more confident about it.
Great. And would you be willing to share your stories with others? You actively want to do it, and if there's people requesting for it, would you encourage people to do so? Would you be, a point of reference to encourage others to do so?
Yeah, absolutely. It was one of the things that helped me make the decision to come was a lot of talking with another New Zealander, Robin Smith, and people around the world, and you realize that your story is very similar to everyone else's, and so I think that really helps make that decision and realize that you can have a better life beyond dealing with pain all the time.
So we have our common sense here: stop the fusion, right, and keep the spine in motion.
Where possible, it makes sense, right?